silence your cell phones. And secondly, if anybody's interested in testifying on any of the items on our agenda today, I'd ask you to sign up the sheet that's in the back corner over here. However, please be aware that testimony may be limited at discretion of the chair in consideration of the time we have available to us today. We have 1 hour. We start our committee on meetings on time, and we finish on time. And committee members, if you feel necessary to explain your votes after being recognized by the chair, I'd appreciate it if you'd limit your explanation to 2 minutes or less. And with that, Becky, if you would please call the roll.
Senator Rocky Adams. Senator Berg. Senator Carroll. Senator Douglas.
Present.
Senator Herron. Senator Mills. Senator Nemes.
Present.
Senator Rawlings. Senator Tishner. Vice Chair Richardson.
Here.
Chairman Meredith.
Present. And we do have a quorum duly constituted to conduct business. With that, we'll go with our first item on our agenda, Senate Bill 27. Senator Storm, if you would, please come to the table. Committee members, you will remember that we heard this bill a couple of weeks ago and have given everybody a chance to properly vet it, and looking forward to some very great discussion this morning, Senator. So if you would, please identify yourself for your record and feel free to proceed.
Thank you, Mr. Chairman. Members of the committee, excuse me, Brandon Storm, Senator of the 21st District.
Jane Rice Williams. I'm the Executive Director of Parkinson's in Motion, a 501c3 nonprofit.
Good to see you here again. You do have a proposed substitute, do you not, Senator?
Yes, we do, Mr. President, or Mr. Chairman.
Would you like to give a brief explanation of that?
Yes, so last time we were here, we had a very good discussion, and I think a question was asked, had we consulted with UK, and we had consulted with UK, and we actually have a representative here from UK in the event there's any difficult questions myself or my colleague can't answer. But after that last meeting, we met with UK, Michael J. Fox Foundation, Jane, and also U of L, and we've come up with a committee sub that basically is attempting to define what a movement disorder center is going to be. Right now, that's not defined in statute, so we're working collaboratively to come up with that. What we did add in the committee sub is also that a representative from the University of Kentucky School of Medicine with specific experience or expertise in Parkinson's disease, and a representative from the University of Louisville School of Medicine with specific expertise in Parkinson's disease would be on this advisory committee. And then the last major change, or 2 more changes, there was an issue regarding whether or not these would be automated reporting or manual, and we've made sure that we took that into account, and it's now going to be automated reporting. And then lastly, the delayed implementation date is going to be moved out to 2027. We hope everything can be up and running before then, but we wanted to make sure that this team had a chance to get all the things in place to get it up and running, and then they will continue to report to this committee during the interim each year. So that's the committee sub.
Excellent. I appreciate that you had a couple of weeks to work on this, and that's, I guess, gives credence to the process. So I appreciate your work on this. To that end, is there a motion to approve the sub? Motion and a second on the sub. All in favor say aye. Aye. Any opposed? All right. If you would, just give a brief summary again of what Senate Bill 27 will do, and 5 minutes will do it because
Sure.
we heard it previously.
Yes, so as you recall, this bill would set up a Kentucky Parkinson's Disease Research Registry, and Parkinson's is the #1 growing neurological disorder in the world. And right now, 2026 data, or it's projected that in 2026 that this is going to be so prevalent in our community. We need to track this. We need to track whether or not the testing is appropriate, the diagnoses are appropriate, and this just lets us have an opportunity to track these individuals. It's very important to know that all individuals have the opportunity to opt out. We also have a provision that in the event someone is inadvertently added in that does not have Parkinson's, there's a method now to get those individuals out, so we wanted to include that as well. And again, this is all going to be confidential. It's not going to be their self-identifying information such as their date of birth or their social security numbers or addresses, their names or anything of that nature, just generic data. And that's the overview. I'll ask my colleague if she would like to.
I just have a couple of things to say, unless you don't understand. Right now, there's no way to diagnose Parkinson's except through watching somebody and talking to them and finding out about their symptoms. There's no cure for Parkinson's. Every time you hear on the radio or on television that we have this new medication for Parkinson's, it's a different delivery system of the medication that's been the main medication since the 1960s. So it's so exciting to see this actually getting some attention here in Frankfurt. I'm very excited about this and hope this continues to move forward. And thank you so much for your votes.
Motion and second on the bill. Please call the roll.
Senator Rocky Adams. Senator Byrd. Senator Carroll.
Aye.
Senator Douglas.
Aye.
Senator Herron. Senator Mills.
Aye.
Senator Nemus.
Aye.
Senator Rawlings. Senator Richardson.
Aye.
Senator Tishner. Chair Meredith.
Aye. Vote is unanimous. Senate Bill 27 is amended by Committee Substitute 1. Passes with favorable expression. So congratulations, Senator, and thank you for presenting this bill to us.
Thank you, Mr. Chairman and members of the committee.
Thank you so much.
Next item on the agenda is hearing on Senate Bill 93. Senator Berg. Certainly welcome you to the table.
Good morning, Mr. Chairman and committee. Thank you for allowing us the time to present this bill this morning. I have two guests with me, Jennifer Hughes, who is the impetus behind the bill, and then Shelley Motes, who is a pediatric audiologist who's coming up to testify on the bill. I'm going to let them talk first because...
Senator, is technicality, but introduce yourself for the record. We know who you are, but...
Good morning. My name is Karen Berg, Kentucky State Senate District 26. Thank you.
Good to have you here. Please proceed. If you would, please make sure your mic is lit, the green light.
Oh, okay. Gotcha.
And
Okay, so I'd like to start by thanking Senator Berg and Senator Meredith for sponsoring this bill. I have a 5-year-old son who's with me today. His name is Everett. He was born with hearing loss. When we first discovered he had hearing loss, I was very worried. I was worried that I had done something to cause his hearing loss. I was worried about how people would treat him, and I feared the challenges that he would have in a hearing world. Everett received his first pair of hearing aids at 2 months old, and we immediately noticed a difference. He was able to respond to sound. I remember his face the first time he heard our voices. His hearing aids have given him access to music. They've been able to help him communicate with others. They've given him an opportunity to be successful. Everett is in kindergarten now, and he's in one of the highest level phonics classes, and he recently received a Math Excellence Award, which I think is a testament to how well his hearing aids have helped level the playing field for him educationally. One of the challenges that we have faced is inadequate coverage for hearing aids for children. When Everett turned 3, his audiologist recommended upgrading his hearing aids, and she quoted us a cost of $5,000 for the pair. Our insurance benefit at the time, we understood it that once we met our deductible, they would cover 50% of the allowable. We later learned that the allowable was $1,000 per hearing aid, and that it's common practice to balance bill the patient the difference between the cost and the allowable amount. So, long story short, we paid the full $5,000 for the hearing aids. Only $2,000 of that went towards our deductible and out of pocket, and then the insurance didn't pay anything. So today, we're asking for support in strengthening the legislation to help alleviate those financial barriers around getting children access to sound. I've had testimonies from other parents where the insurance deemed the hearing aids elective or cosmetic, which is just crazy to me. But that's what we're here for. We're here for support, trying to get better legislation to help these children have access to sound. Thank you.
Thank you.
before we proceed, you have a committee sub on this bill, so could you speak to that just briefly?
And thank you. There is a committee sub. Hopefully everybody got it both in your email and you have it this morning. The committee sub basically does several things. The most important things it does, unfortunately, it excludes adults. The original bill had included adults with severe and profound hearing loss. And not that that's not very, very important, and it is, and it does definitely have a lot to do with the development of dementia in older people. It is something that should be discussed, but the intent of this bill was really for children. So I did take the adults out, and then the other thing I did do was basically add a requirement. This is something I discovered during the course of this bill, that like with the pharmacy benefit managers, a lot of the insurance companies are contracting out to a third-party provider their hearing aid coverage. But these third-party providers have no pediatric audiologists in network and have no requirement to have pediatric audiologists in network. With the HMOs, we passed laws that required that you had an adequate network. With even the PBMs, you have to have an adequate network. But there is nothing in this that requires them. So they haven't had an adequate network. So those are really the two big changes in the sub. Aye. Thank you. Sub is adopted.
Please proceed.
Good morning. I would like to thank Senator Berg and Meredith for being the co-sponsors of this bill, and wanted to share a little background on the state of pediatric hearing loss in Kentucky. In 2023, about 58,000 babies were born in the Commonwealth, and of those babies, about 175 were born with permanent hearing loss. Hearing loss is the most common congenital disability, affecting about 3 in 1,000 newborns. Research shows that if babies are receiving their hearing screening by 1 month, identified with their permanent hearing loss by 3 months, and enrolled in early intervention by 6 months, that their language outcomes are significantly better by the time they reach kindergarten. Appropriately fit hearing aids provide a child with access to the world around them. It allows them to hear their parents. It allows them to talk with their friends on the playground. It allows them to hear music. It allows them to learn. And all of those things are very important to quality of life. In July 2002, the Kentucky legislature passed a law requiring that insurance plans cover hearing aids for children under the age of 18. That law, although extremely well-intentioned, has not kept pace with changes in the healthcare environment, specifically the advent of high-deductible insurance plans. And as a result, as Jennifer stated, most parents end up being completely out of pocket on the purchase of hearing aids for their child. For a child who is born today in Kentucky and confirmed to have permanent hearing loss, we can anticipate that in today's dollars, parents will spend approximately $30,000 on hearing aids between the ages of birth and 18. That is devices only. That does not include visits to the audiologist. That does not include speech therapy. That does not include other medical appointments. And it also doesn't include the difficult to quantify cost of time away from work for families to obtain the care that they need for their child. I am so appreciative that this bill is coming forward today, and I urge you to think about the 175 or so children that will be born this year in Kentucky with permanent hearing loss, whose quality of life can be altered by the decision that you make today. Thank you so much.
Thank you. We do have a couple questions before I entertain the motion. Senator Richardson.
Just a simple question, and this is just for my own education.
Mm-hmm.
Thank you so much for being here, and thank you for what you do. I love to see parents that have been affected that turn that into advocacy. This is pretty new to me. Love what you're doing, but the cost associated with this, is it because we're talking about size and development of a child through adolescence, ear canal and things like that? Is that part of the cost?
It's less related to the ear canal. Children typically are fit with hearing aids that go behind the ear, which is a piece that goes back here, and then there's a custom piece inside the ear. The reason that there is a replacement cost over time is because we are putting electronic devices on a sweaty, dirty, active head. And so there is a life expectancy, and the typical life of a hearing aid is about 5 years. Mm-hmm.
Senator Mills.
Thank you, Mr. Chairman. Senator Berg, thank you for this bill. Question, I just noticed, I was looking up, it had a fiscal note on it. That fiscal note was for the original bill, is that correct?
That is correct.
You want to speak to that?
We have requested a second fiscal note. We have not gotten that back, but the assumption is going to be that it's less than the current because we excluded adults. And the original fiscal bill included those people.
Okay. Can I follow up one?
Yes, please.
And then kind of to go along with your last comment, since these are going on kids and there's a little bit, as a guy that had glasses since he was 3, I know that kids break things. And is there going to be some responsibility on the parents as far as like maintenance and breakage and lossage? Like they can only get one every 2 years or every 5 years, or is there something like that?
So the hearing aid device manufacturers understand that we are putting these hearing aids on a population that is at risk for things like loss or breakage. And so the cost of the hearing aid does include unlimited repair and also a one-time loss and damage replacement for each device during the original warranty period. And I believe that the bill was updated to add a replacement interval so that the hearing aids would not be replaced more frequently than every 3 years.
Yes.
Which is consistent with what Medicaid guidelines currently offer in Kentucky.
Senator Carroll.
Thank you, Mr. Chairman. Can you elaborate a little bit on the differences in the coverage with the private insurers? Are those companies, do they vary in their policies? And as far as with Medicaid MCOs, are there struggles with MCOs as in every other area they cover to get them to pay? And that may be a little deep for today, but
So the current legislation, as written, authorizes coverage for 80% up to $1,400, and that up to language is where it's problematic. For example, one major insurer that writes policies in Kentucky's caps their allowable at $1,000 per aid because it says up to. The MCOs are a very complicated and ongoing issue. I feel like that might be outside of the scope of the discussion here in terms of issues with payment, since the bill is really looking more at commercial insurance coverage versus Medicaid.
thank you, Mr. Chairman.
There be no further questions, comments, entertain a motion on the bill? Motion and second? All right, roll call, please.
Senator Rocky Adams, Senator Berg,
Aye.
Senator Carroll,
Aye.
Senator Douglas,
Aye.
Senator Herron, Senator Mills, Senator Nemes,
Aye.
Senator Rawlings, Senator Richardson, Senator Tishner, Chairman Meredith.
Aye. Motion passes unanimously. So Senate Bill 93 is amended. Passes with favorable expression. Congratulations, Senator. Congratulations.
Thank you, sir.
Our last bill for consideration today is Senate Bill 153, with the sponsor being Senator Craig Richardson.
Good morning, Mr. Chairman, members of this committee. My name is Senator Craig Richardson. I represent the 3rd District, Christian, Caldwell, and Muhlenberg counties in western Kentucky. I'm joined today by Randy Hunter, CEO of Frontier. Yes, Frontier Behavioral Health. Frontier Behavioral Health, and Jessica Burke, General Counsel for Addiction Recovery. There is a committee sub on this bill.
Motion on sub.
Motion is second. Second, all those in favor say aye.
Aye.
Any opposition? Being none, please proceed.
Thank you so much again for members of this committee. If it hasn't become apparent already in the 45-ish something days that I've been a legislator, much like our dear chairman, I too echo his sentiments and care very deeply about rural health and health care for our Commonwealth. I often say this, that I I married a oncology pharmacist who very much loves what she does and battles through the difficulty of that on a regular basis. And I have had past experiences in home health and telehealth in businesses that I owned. So this is near and dear to my heart. This is a transparency bill, Senate Bill 153. We're looking to implement due process and notice. This is a bill specifically about prepayment review. And just as a quick overview of what prepayment review is a process where a healthcare provider, the healthcare provider claims are reviewed by a Medicaid agency before payment is issued. So it's withholding payment to verify the accuracy and appropriateness of those services. And that's fair. And we understand that there's an appropriateness for that in some cases. However, currently, we feel that prepayment reviews can be and are sometimes implemented with minimal notification. Not only are they implemented with minimal notification, but also not given the clearest guidelines to the provider as to what the reasons being that a claim might be withheld from payment. So this does a lot of things. One, and again, if we look at rural health and smaller provider institutions, they might have limited staff to appropriately and effectively and in a timely manner investigate and correct these prepayment review claims so that they can get paid. Second to that is the payment process. It slows down cash flow for providers to continue to offer quality and appropriate care for their patients. So we are just asking in this bill that not only these prepayment reviews be done in a timely manner, but that the guidelines and the transparency exist so that providers know what corrections they need to make. Corrections that need to be made long-term, perhaps in internal systems, or corrections in how they gather data and information. Currently, per DMS, and Department of Medicaid Services, to be respectful to Senator Douglas, who doesn't like acronyms, and I appreciate that very much, but Medicaid Services, this is regulatory for them already. So this just codifies, in a way, what is already in practice and should be in practice to help both the department, it helps the MCOs continue to understand their guidelines, and it helps the providers. And I think that this transparency will allow for better healthcare outcomes. I'll turn the time over. I'll start with first Ms. Burke to speak briefly on it, and then Mr. Hunter.
Thank you, Senator. Jessica Burke, Chief Legal Officer for Addiction Recovery Care. Very briefly, as has been already stated, this is not a bill to stop prepayment reviews. We understand that they have a place in the system. What this is a bill to stop the prepayment reviews without notice, without any kind of transparency, and putting an undue burden on providers. Right now, a prepayment review can be put on a provider with 48 hours notice. The provider does not have to be told why that prepayment review is there. They don't have to be told what the MCO is looking for. They don't have to be told what they have to do to get off that prepayment review. And so a provider has their cash flow disrupted, has to allot staff to deal with that prepayment review. And they're not really, it's like if you were charged with a crime, but they don't tell you what you're charged with, and they don't tell you when the trial is going to be, and you kind of have to just guess. That's what we're dealing with now. So this bill is to put some transparency, put some due notice requirements into that system, and so the provider can operate efficiently, can operate fairly, and that the Medicaid system can operate the way it was intended to operate.
Yes, Randy Hunter. I'm the CEO with Frontier Behavioral Health. Just briefly, back on August 16th of 2024, we became aware of a 20% rate cut that had been imposed by one of the MCOs here in the Commonwealth. We'd reached out to the MCO that same day, and we'd questioned why the reimbursement had been decreased. They didn't really answer the question, but instead they stated they had sent a letter to Frontier notifying us that there would be a rate decrease effective July 1 of 2024. We've never received any notification of any letter at Frontier Behavioral Health. Subsequently, after that, after receiving that information on August the 27th, we began receiving letters stating that we had been placed on prepayment review, and the only reason that was given on these letters was SIU initiated. These letters contained a phone number to call with any questions or concerns or how to proceed with the prepayment review process. We reached out to that phone number, and that phone number, we learned later, had already been disconnected and was no longer in service. We had reached out to the MCO by email through our provider rep. We didn't receive any information, and we continued to receive letters for the next few days about the prepayment review. Unable to receive any response from WellCare, we filed a complaint and made a motion for a temporary restraining order in Jefferson Circuit Court. During the court proceedings, we learned that the prepayment review was limited to 2 CPT codes. Also in the court proceedings, we learned that the reason for the review was because we were supposedly an outlier of these prepayment codes. No additional information about the status was provided. The prepayment review began on October the 28th of 2024. No date was set for the prepayment review to end. Instead, the MCO relies upon the Kentucky Master Agreement for Medicaid MCO provision requiring the MCOs to obtain express permission from DMS to continue prepayment review if the provider sustains a 90% error-free claim submission for 45 days. We believe that we have complied with these requests. We are now receiving payments for these services, but we're roughly receiving payments 75 days late. After multiple requests for a status update, we have not received any information. We have sent multiple emails. We have sent letters to the general counsel for that MCO and also to the MCO, but we have received any information about when this will end. That's where we are today.
Would you even care to speculate on how much your organization has spent on this specific administrative nightmare? I call it a nightmare.
Tens of thousands of dollars, sir.
And to speak to Senator Douglas's aversion to MCOs, that stands for Managed Cash Organization.
Motion on the bill.
Second. Motion is second. Senator Carroll, do you have a question?
Just quickly, Mr. Chairman, and we talk about this so often. The organization I lead, we went through this with an MCO recently, over one CPT code that we've used ever since we've been providing services. And it's nothing more than a tactic to delay payment, as the MCOs are very adept at doing. In conversations with Secretary Friedlander, with the contracts, and I didn't know till a couple weeks ago that the MCOs are not required to even pay Medicaid rates. There was an agreement to pay certain providers for mental health services for youth. The cabinet offered an increased rate. MCO was refusing to pay that rate. And that's when I discovered that they're under no obligation to do that. And it all boils down to the contracts. And, you know, as a state, we've got to tighten those contracts up. And so my question is, with this language, is there any conflict with the contracts with the MCOs that could come into play as we move forward?
No, and I'll let the experts back me up on this, but no, there's nothing in this bill that would create a conflict. And I go back to that the DMS, Department of Medicaid Services, Senator Douglas, but this is regulatory already. It's just not codified in statute. So I think that kind of helps clear up that there's not going to be any conflict in ongoing negotiations or contracts with that. Would that be your assessment as well, Ms. Burke?
Yes, I'm not aware of anything. And of course, every provider has different contracts, so I can't speak to any of the provider. There's nothing that I'm aware of in the contracts that would conflict with this that I'm aware of. And also, the contracts are subject to Kentucky and federal law, so this should supersede any conflicting language.
Thank you, Mr. Chairman.
Thank you for your question, Senator Carroll. Don't mean to do a commercial for my own bill. We've already passed it through this chamber, but the 3MCO bill calls for those contracts to be relet. And there's been some pushback against that. You know, if we don't do this, then the current contracts can stay until 2032 because 2-year automatic renewal periods. And it's not just an inadequacy of this issue, but I don't think there's sufficient safeguards for things like the proliferation of AI or data breaches. And this is a relatively old contract in a community that changes quite quickly. So we need to look at that contract, particularly in light of the anticipated Medicaid cuts that are coming. So, Senator Adams.
Thank you, Mr. Chairman. Just a quick question. I mean, does DMS allow the MCOs to even interact with providers kind of while they're on this list? I mean, will this bill help correct that?
I can't answer the question, but I can say that this bill will help correct that. Because I can't answer the question necessarily between what is regulated currently and what DMS can do and is doing, I'm not sure. And I don't think it's very clear what is taking place, even though it's written for them to do a job and they are supposed to technically, the prepayment review process is supposed to go from the MCO to DMS. They are to approve that prepayment review, and then it can go then to the provider. What communication is taking place, or perhaps lack thereof, I can't speculate. This bill cleans it up for all parties involved.
Okay.
The Medicaid care organizations, providers, and DMS.
Okay, that's good to know, because we like to give the MCOs a hard time, but then sometimes they're precluded from even communicating. So that's
and I appreciate you bringing that up because I'm not going to take the position that the MCOs, anybody's necessarily a bad actor.
Yeah.
My law background has taught me that guardrails and guidelines and transparency help everyone across the board, and especially if we're sort of entering into this new age with Medicare. And certain uncertainties. I'm not entirely sure that works, but with uncertainty, that at least for us here in the Commonwealth to have this transparency and these guardrails in place allows us to be in a knowledgeable place for all parties involved, regardless of what changes may come.
Okay, great. Thanks.
Thank you, Senator. We do have a motion and a second on the bill. Roll call, please.
Senator Rocky Adams. Senator Berg. Senator Carroll.
Aye.
Senator Douglas.
Aye, but explain my vote.
Yes, please.
Thank you, Mr. Chairman. I did want to address three points that you brought up. And Senator Richardson, I want to thank you and the two experts that you brought here. This is something that has needed to be addressed for a long, long time. First of all, often payments aren't denied. They're just not approved. And most people don't know that. They essentially do the same thing for those people who are providing the care. It holds their money. They can't pay their people in their office. We talk about the outliers, and the problem with them doing some of those statistics and saying, okay, you're an outlying clinic, so therefore we don't want to pay for you. For those of us who are specialists, what do you think we do? We take care of specialties, and therefore our numbers are higher than our colleagues. And so money gets held from people who do specialty things because we do specialty things, which is why other people send them to us. So you were 100% on there. And then the third thing that you spoke up was the changing of the rules in the middle of the game. Happens all the time. The people who are in managed care organizations come in expecting that they're going to have a certain procedure covered or something covered, and they find out, oh, well, my managed care organization has decided that since they're not going to be meeting their financial goals, that they're not going to cover that this month. And for those who are on the committee who don't believe that happens, I assure you 100% it does. So I want to thank you so very much, Senator Richardson, and you too as well for bringing this much needed change in bill. Thank you. Thank you, Mr. Chairman.
Senator Herron. Aye. Senator Mills.
Aye.
Senator Nemes.
Aye.
Senator Rawlings. Aye. Senator Richardson. Aye. Senator Tishner. Chairman Meredith.
Aye. The vote is unanimous, and Bill 153 is amended, passes with favorable expression. Congratulations, Senator. We have one other item of business, should be very brief. We have one referred administrative regulation, and this is probably already a moot point because action that the House has taken just recently. This will go in effect March 4th. So to that end, anybody have any questions, comments, concerns? If not, we consider them approved. Want you to note that we may have a special call meeting Monday. Starting to get some things from the House. Don't know for certain. I have to meet with leadership this afternoon, but just put you on notice that we may meet Monday. If not, the next meeting will be our regular meeting date of Wednesday, March 5th, but we'll let you know that this possibly this evening. Okay? All right. Any other business needs to come before this body? So moved. Thank you. Appreciate everybody attending.